This module is an introduction to GS1 and the standards used in the healthcare industry. Our purpose as a neutral, not-for-profit membership organisation is to bring industry together to address problems that they can't solve alone. We're not a government organisation, and the GS1 standards have and continue to be created with industry agreement. It all started back in 1973 when the first barcode was approved in the US for retail, and that was then scanned in 1974 on a 10-pack of Wrigley's Juicy Fruit. We've grown a lot since 1973. The first GS1 organisation, then called the Uniform Code Council, was created in the United States, followed a couple of years later by a group of European countries coming together, and we've grown to 118 local member organisations providing support to industry and our members to adopt GS1 standards across many different industries and to over 2,000 companies worldwide. It's estimated that over 10 billion GS1 barcodes are scanned daily on over 100 million products. Everything we do is built on the foundations of identify, capture, and share. In simple terms, this is capturing a unique product code in a barcode and scanning it to share information. The adoption of GS1 standards has been driven by several programs and legislation. In 2014, the Department of Health and Social Care published the NHS e-procurement strategy, which mandated the use of GS1 standards for suppliers of medical devices and pharmaceuticals to the NHS. It also talked about using GS1 standards for applications within hospitals to improve procurement processes that lead to improved patient safety. A couple of years after that was published, the Scan for Safety programme began, where 6 trusts across England became demonstrator sites and were funded to implement GS1 standards and to report back on their findings and produce guidance for other NHS trusts to help them implement those same standards for those same applications. NHS Supply Chain has launched a programme to support the implementation of inventory management systems across 20 trusts that will utilise GS1 standards for product identification. The other UK nations have their own Scan for Safety programmes, including Scotland implementing a nationwide inventory management system and Wales rolling out a nationwide procurement and replenishment system using the scanning of product barcodes. Northern Ireland is introducing GS1 standards via its nationwide Encompass programme and has started using GS1 standards for asset tracking. In the US, the FDA introduced legislation for unique device identification on medical devices. The GS1 system is by far the most prevalent of the barcoding standards that are used for medical device identification. That was followed by the EU medical device regulations, and GS1 standards work in the same way, which is the benefit of using standards. You don't have to change out what you're already doing for different markets. The Medicines and Medical Devices Act in the UK provides a platform for medical device regulation to be implemented in the UK. More on that to follow from the MHRA. I'm now going to talk specifically about product because that is the most relevant to medical device manufacturers. Here's an excerpt from the EU MDR, and it's like the FDA's UDR regulations. Both require DIs and PIs to identify products. In later modules, you'll be able to discuss how you allocate global trade item numbers or GTINs to your products and how to encode the dynamic production information, such as dates and lot, within the GS1 barcodes. This shows how the GS1 foundations of identify, capture, and share fit with the UDI regulations. The UDI is the GTIN to identify the product plus the production information. AIDC is the barcode to capture the GTIN and production information. And the GTINs are shared via UDI databases such as the GoodID in the US and UDAMED in Europe. The MHRA has its own medical devices registry, and you can already enter your GTINs into this system. Thank you to GS1 Ireland for producing this graphic. Here we see an image of the theatre, and we can see where the GS1 identification keys are used. We have the GLN, the global location number for the location of where the procedure is taking place, and the GTIN that's identifying the syringe as a medical device. We have a GSRN, global service relation number, which is identifying the patient and the caregiver. And we also have the GIAI, a global individual asset identifier, which is identifying individual assets such as a gas cylinder and a surgical instrument. This point of care scanning provides for more accurate traceability to improve the product recall process and feeds into medical device outcomes registries to make for better care. GS1 standards are used to identify every person, every product, and every place within the GS1 system.